acknowledge the traditional owners of the land on which we meet, the Wurundjeri people of the Kulin Nation. Pay my respect to elders past, present and any emerging leaders who are here today. Acknowledge their incredible resilience and also acknowledge that this land was never ceded. So thank you and welcome to one of the homes of Drummond Street. So we are a not-for-profit organisation, and if you're like me, a bit of a history buff. We are 131 years old. Most people don't actually know that about Drummond Street at all. We actually, the longest running name that most people will remember is the Citizens Welfare Service of Victoria, that was around for a very, very long time. It has a very unusual commencement. And why that's important is that the reason it was established has very much held and informed the values of the organisation and the way in which we work. So we were established as a result of a death of an itinerant worker in around 1887 as a result of a coroner's court inquiry into the death of someone outside sitting in a taxi, a horse-drawn taxi, trying to get a service in Royal Melbourne Hospital. And largely in those days, charity obviously was about deserving poor and often driven by faith. This literary professor thought this was incredibly bad in that we did not recognise and use data we had at hand at that time in order to distribute resources across Melbourne to indeed respond to an influenza outbreak. So in its early days, it was established to say we should not be using morality or faith-driven morality around where services should be going, but actually using science. So it has this long history of how we both contribute to science in order to respond to the changing, very changing social needs of our community and see ourselves as part of the fabric of community. Well, that sets up a whole range of ways about how you think about people walking in the door, and also the people that don't walk in the door and aren't getting the services. So Drummond Street therefore has a history of, in particular, focusing on people who don't normally engage with services and some of our most vulnerable and marginalised cohorts in the community, but also thinking about where we put our targeted services across the life course, particularly in the mental health area, in order that we respond early in life. So couple transition to families we know sets up a range of risks around poor mental health for both adults and for kids. So we really target and focus and partner with our universal platforms like maternal and child health, etc., in order to get to those families what is largely a really kind of positive experience, but we know that carries quite a bit of vulnerability. And in addition to that, we think about, in particular, those communities like our refugee, humanitarian entrants, and of course, our large-scale work with the LGBTI community. All of those communities, as you know, show up in poor health outcomes. Largely, our experience of government funding is very single issue. It's your mental health, it's your drug and alcohol, it's your... When you're a service provider, you don't get to do that. So largely our experience in terms of the incredible role that the Primary Health Network, and through their commissioning process, allow us to actually talk to them about what we're noticing, what our service data shows us about who's not walking through the door, who we're not getting to early enough, who doesn't find mainstream services very sensitive to their needs, and also can work across a range of issues. None of these things fall in isolation. So when I think about the funding that the PHN has given us, it closes so many of those gaps. The fact that we have this direct communication using our data to show that a lot of families are really reticent to talk about mental health issues. A lot of families don't think necessarily of using language about mental health, but they'll talk about poverty. They'll talk about not being able to put food on the table. They'll talk about the horrible experiences that sometimes they get at other service systems. So that's driven a lot of the work that we do and the communication that we have in terms of co-design processes with the PHN. And so then we have these amazing services that we're funded to provide that are impacting on things like the high rates of LGBTI mental health right across every part of that acronym, because it's not an equal burden of mental health across that acronym. Our trans community in particular, because of higher levels of family violence, are far more likely to have trauma histories, far more likely to be shut out of education, homeless, and a whole range of things. What that bucket of funding that the PHN gives us is a capacity to join those dots and really target the most vulnerable, but have a kind of suite of services that we can wrap around. So having the mental health funding sitting along our side, our AOD funding, our housing homelessness work, our LGBTI family violence work, we have to think about what piece of that money helps us to do that extra bit. When we can see in our growth corridors so many families that are struggling with poor mental health through that kind of transition into parenthood, but actually see that because they are moving away from their families of origin, or they have no families of origin, they are far more likely to have poorer mental health, they're far more likely to be socially isolated, and they're far more likely to have extreme levels of financial disadvantage. So the bucket of money that supports our work in mental health has to work alongside our efforts to get them connected into community, to have very diverse workforces that people feel comfortable walking in. One of the things we're very proud of at Drummond Street and the PHN has supported us with is in particular having lived experience workforces, so that people when they walk in here see people that look like them, that have similar experiences of them, and therefore know what it is to recover, but also provides an enormous amount of hope that you can recover and you can put these things and wrap these things around you, and that supports you with your mental health, but also your children's mental health as well. And we forget that a lot of these programs that may be focused in on adults have immeasurable outcomes for, in a protected sense, for kids going forward. So that's Drummond Street. Have I missed any programs? My staff will. Yeah. Any questions? Anyone wants to ask? I've got lots of people who are here who can answer them.
It'd be great if some of the staff would do some interviews with us with the director.
Absolutely. They're all geared up here and can answer all sorts of questions from different program areas.
I was going to ask, did you just have this space, or are you based out through the suburbs as well?
From last count, I think we've got 5 locations, and we outreach into community. So we think long and hard about where our community people are, where we can situate ourselves in order to make it very accessible to people, but that also means we'll hop in cars and go to people's homes, and that's really important. So that's all the way out from Epping. We're about to open a big new location in Coburg. We're out at Brimbank. We're out at Hoppers Crossing. We're down at Geelong. We're here in Carlton. We're at Collingwood High Rise Housing Estate. We're at North Melbourne. And we also co-locate ourselves with the universal platforms like maternal and child health, etc. And that's really important, so that people know us and feel that they trust the staff and the messaging that we give people, so that they feel comfortable about talking about kind of bigger things. Yeah.
I've got a question that relates to my community. So I was raised a Jehovah's Witness, and they are generally, as a community, poor, uneducated. They also have a high incidence of suicide. They're not allowed to be gay. And so a lot of them are now leaving the organisation as we've got smartphones and the internet. They're working out that it's not working for them. So I'm interested in knowing here, with your services, do you get a lot of ex-Jehovah's Witnesses coming or other cult communities?
Yes, and I think the issue of faith and the experience in which LGBTI young people are raised in are important things. So to take a holistic viewpoint of not everyone wants to walk away necessarily from faith. So how, and we know spiritual connectedness is such an important part for a lot of people around their mental health. So being able to work with people around where they want to get to, not only in terms of their sexuality and gender, but also in terms of their faith, their connection to faith, their connection to the LGBTI community. So our services have to think holistically and work with them about how they get to where they need to in terms of that. Yep.
We're going to be here for about another 15 minutes or so that
Yep.
people can have chats and we can do some
Yep.
interviews. There is also, probably already mentioned, the Promise